cross over now to Kwale County and speak to Governor Salim Mvurya, County 002. Good morning, Governor.
Good morning. How are you?
Salama kabisa. Thank you very much and welcome to the Situation Room.
Thank you very much.
Now, Governor, Kwale has now gone into isolation since 7 p.m. last night.
Yes.
How is it for you? Do you feel this was a good measure? Do you feel that we should have gone the full hammer and done a complete lockdown?
I think in terms of what the president has directed, this is okay to have the partial lockdown, because the partial lockdown is happening amongst the other measures that have already been taken by government, and I think this is a good step in managing the COVID-19 spread in the county and in the country.
Now, we're seeing that you have one case still in Kwale.
Yes, we had one case. This was a guest from France who tested positive.
Yep.
And this guest was treated at the Sambweni Referral Hospital. And then after some time, we transferred the patient to Nairobi. And then after that, he was transferred to Paris.
So the exposure here, I'm assuming that because Kwale only has one case, the exposure here is that you're fearing the exposure from Mombasa, which has many more cases.
Yeah, and also the guest had contact with people when he was in Kwale, so we were also able to put them under quarantine.
Right.
And now with this lockdown, then we are able now to control movement within the county, so that if there are cases from other counties, then we are able to control through the partial lockdown.
Governor Mvurya, we're seeing a number of things happening across county in the country to mitigate and to bring in measures that will help with this fight against COVID-19. Could you give us a snapshot of some of the things that are happening in Kwale County to fight?
First of all, in Kwale County, we have been able to set up isolation centers in our key hospitals. We are also on the ground doing disinfection in most of the areas, the market centers and other public places. We have gone on also to sensitize our people on the hand washing and social distancing. So this is happening in the county. And this is in addition to the other measures that we have taken as national government and county government for public transport and other measures in public places.
Do you find that the people of the county are receptive to these measures and doing what they're supposed to be doing according to directives?
Yes, the people are receptive to the measures that have been put by both levels of government, but also we have to continue enforcing, because we also have a section of the population that still requires enforcement. So we continuously monitor on the ground with our officers and also security officers to see that these measures are enforced at all levels.
What kind of enforcement are you having? When we speak to many of our listeners and viewers, they keep telling us about flouting of these measures. One, especially public transport, and also in public places like markets, where traders are still within 1 meter of one another, and markets not controlling the number of people who are entering there.
One of the areas of enforcement, like I give an example of here in Diani, there was a market around a place called Ibiza, so we were able to close that one, and we relocated the traders at another place where our officers went down to even identify and put the traders 1.5 meters apart, and also to make sure that all the traders had a bucket of water and soap in the areas, and because there's a gate, we also control the movement of people in and outside the new market area.
Right.
Yes.
Governor, good morning.
Good morning.
I am C.T. Munga. I first of all want to commend you for your incredible track record for development, incredible track record for looking after the lives of the people of Kwale.
Thank you very much.
Yes, I have been following your work very keenly.
Thank you very much.
Now let me ask the question. How many tests have you actually conducted within Kwale?
Right now we have tested over 40 people that we have suspected before.
Yes.
And we continue to do that, especially for those that we have now put in quarantine. So we've done 43.
Yes.
And the 43, we are very happy that they have been negative. And yesterday we took samples and we continue to do the testing. So we should be able to get results today or tomorrow for the cases that we did yesterday.
Do you have any plans for mass testing?
Yes, we have ordered for some rapid testing equipment, and once we have them today or tomorrow, then we should be able to roll out mass and random testing across the county.
What is the population of Kwale County?
The population of Kwale County, from the current census, we are around slightly above 800,000. Yes.
Now, as far as I know, Kwale County also borders Tanzania.
Yes.
What measures has Kwale County taken, especially with the fishing community that go into those waters back and forth, and who are very, very likely to be in contact with people who are not necessarily Kenyans, and whose capacity for spreading any, should we say any disease, is usually very, very high? What is the county government doing to ensure that our borders are well protected?
First of all, the border with Tanzania has been closed. And as a team, because we have a team at the county level that plans all these things, we have strengthened measures to do surveillance across the border. We are also working with the Coast Guard around the Indian Ocean to monitor movement. We have also sensitized our fishermen. So around Shimoni, we have a multi-agency team, the security forces, and our teams are also there to make sure that they are able to handle issues around the Indian Ocean.
Speaking of the Coast Guard and the fishermen, there were initial concerns that the 7 p.m. to 5 a.m. curfew would impact heavily on the fishermen who are actually their hours of operation are usually at night.
Yes.
What has the county done to help them with that?
Yes, that is an issue which we are continuing to engage, because remember here we have a tight balancing act. We have to protect our people against the spread of this virus. But on one hand, they also have livelihood. So that is an area that we are still seeing how we can balance the priorities of fishermen and also handle this spread of COVID-19. So we have sent our teams to engage and see amicably how we can be able to resolve that. But as the current situation, there are a lot of patrols around the Indian Ocean, because again we have, we are also near Pemba, so fishermen can easily come to Kenya from Tanzania. So that is an area also which patrols have been heightened.
You're talking about conversations still ongoing. I mean, it's about 10 days after the curfew came into effect. If people have been affected for 10 days, they still don't know whether they ought to go out to fish and all. Don't you think that is taking a bit too long? I would assume that you have mechanisms of establishing exactly the number of fishermen and who they are, and you can identify them and maybe work with the Coast Guard and the police to allow them to go fishing and come back and just monitor their movements?
You know, some of these are also on a case-by-case basis. So that is why some of those cases come, they are resolved, and others. So that engagement is a continuous process, because I know there are some who do fishing during the day. So it's a case-by-case basis, and we've asked the teams to look at it in that manner.
In case things get tighter, with the likelihood of such, with the numbers that we are seeing on an increase, is there something that's going to be put in place in terms of measures to help those who may not then have access to basic things like food and water on a daily basis?
Yes, we have done a quick survey as a county government and also national government. And we have been looking at the issue of vulnerability as a result of this pandemic. And currently we have around slightly above 67% of the households who would be vulnerable because of this pandemic. So we have put in measures to mobilize food items. We have put in measures also to mobilize cash resources so that we are able to support the vulnerable households. And as we speak, as a county government, we've also already engaged our county assembly, and we are reviewing and refocusing our financial resources to be able to have much more resources for food items, resources for water solutions in the community, so that then we are able to provide on the ground support. So I'm sure in the next few days we should be rolling out this particular program.
Okay. Do you have a fund that has been set up? We've seen at the national level there's a fund that's been set up. Some counties have also come up with funds where counties are mobilizing resources from the community using those avenues. Have you done the same in Kwale?
Yes, we've done the same. We've set up an emergency response fund, and this is where we have advised our partners and well-wishers to make a contribution both in cash and in kind.
Governor, I'd just like to ask, in Kwale County, we have we've read and we've heard of many health practitioners, some who are registered, some who are unregistered, some who are traditional. Some even claim to have a cure for COVID-19, as they claim to have cures for all other ailments. How are you dealing with such people?
First of all, we have we have said it very clearly that we will not allow shrewd solutions like people saying they have a cure for COVID-19. We know globally there has, a cure has not been found.
Yep.
So we have advised our citizens to ignore any propaganda in this direction. Because I remember even in the last, I think 1 week and a half, there was a rumor that some people were saying if you drink black tea before dawn, then you will be cured of COVID-19. So I have even gone to make a press statement on this to say that they need to ignore all this propaganda. And you agree with me, black tea cannot cure COVID-19.
No.
What channels are you using to communicate to the people? As a county government, you've got infrastructure down to the village level. How are you communicating to the people?
As a county government here in Kwale, we have infrastructure up to the village level. We have village administrators. So what we have done is we have paired, our officers with those of the national government. So they are on the ground. And we also have public health officers in the various dispensaries in the rural areas. We have community health volunteers.
Yeah.
So we have mobilized all these people and put them in teams so that they move around the villages to sensitize people. We have also supported them with vehicles. They mount public address systems and do sensitization in the markets and in rural areas.
In the event of a full-out breakout of COVID-19, Governor, what do you have in place to address that? Say cases just start rising to 50, 100, 1,000. What would you do?
Of course, that will be catastrophic if it raises to that level. But we are also building our capacities in the health facilities to be able to at least handle some treatment in our referral hospital. Because already here we have an ICU facility with 10 beds and an HDU. So we are mobilizing equipment so that we are able to handle even treatment at this level. We have also identified quarantine centers, like in our Kenya Medical Training College in Musambweni and Matuga. And of course, you've heard that we also have to identify schools so that we are able to prepare them for the worst. Yeah.
We are seeing also that some areas have been identified in Kwale as isolation centers. And from the national side, the numbers that we have, you have 2,436 bed capacity of isolation centers coming from School of Government in Matuga, Kwale High School, Wa Boys, Wa Girls, Kayatiwi, Msambweni Boys, and Kingwede Girls.
Yes.
So in this particular, these are schools, these are institutions. So they have the dormitories, they have the beds. But what else? What else do you need to ensure that these facilities work as isolation facilities for COVID-19 specifically?
First of all, these facilities, for them to be able to effectively be quarantine centers, even though they have beds and all those, they have to be spaced so that the beds that students use is not the same in terms of distance that quarantine people will be able to handle.
Yep.
These areas will also have to be very clean. These areas have to have running water all the time. So these are some of the things that we will need to fix, and we have water boozers also strategically placed to support these facilities in case they don't have running water.
How about medical personnel?
And also, we are hiring actually more medical personnel as we speak. We've already put the advert so that then we are able to prepare for more numbers. So we have already advertised, and we should be able to hire more, around 150 more personnel to handle the situation.
Okay. Governor, as City had talked about, clearly that it was evident the work that you had done concerning Kwale County over time definitely received a facelift. We heard more about the county in ways that we've never heard of it before. Do you think that COVID presents an opportunity to even see other gaps that may have been experienced in terms of development of the county that can then be realized even after COVID is a thing of the past?
Yes, I think COVID-19 has posed a challenge to our healthcare system, and not just our healthcare system, but integratively the entire development system has been challenged. So we are seeing an area here in terms of expanding, services in water provision in all areas, which we have to put in more resources. We are also finding here the issue of having more personnel, especially public health, putting more emphasis on preventive and also balancing with curative. So these are areas that we are now realizing. I'm sure it's not just here, but in most counties that we need to invest more in preventive measures. And again, the entire area of disaster risk reduction and preparedness. these are now new areas that we need to focus on.
Yeah.
So that when we are faced with the pandemic, then we have a standard operation procedure that we can easily invoke and begin to respond.
Even
so
after.
the area of preparedness is really key. Yeah.
So we know that in a few weeks' time we'll be going into Ramadan, and there are very many Muslims in Kwale County.
Yes.
What kind of preparation do you have as a county government for this period? People will want to have access to food at the end of the day, but also at the same time, it's a time when people like to congregate. What are you putting in place?
I think as already directed, the congregations have been banned. Remember, we have even closed the mosque and other prayer facilities. So again, during the month of Ramadan, we expect that there will be demand for food items to our people. And that is why we have put in this as part of the mobilization, so that during that time, we can be able to respond, especially to the vulnerable families that are not able to find food around that time. But again, we will need to maintain the issue of social distance. We will not compromise.
Yeah.
Because again, we know if we begin now to congregate, then we jeopardize everyone in terms of the infection. Yeah.
Yes, Kwale takes a very key position in the tourist industry, and you also have other manufacturing industry. You have industries like mining. I want to know, what part are they playing in helping the county of Kwale in alleviating these issues? And do you have a feeding program, and can they feed into this? Can they work together with you to help provide a solution for the people of Kwale?
Yes, what we have done, we have mobilized the entire private sector in Kwale to be able to be part of this team. To make a contribution in any way in terms of alleviating this particular challenge. And I'm happy the response has been very good. We have seen the private sector coming out with, some have made contribution, sanitizers, water tanks. So we've had contributions across the board, and we've also engaged the mining sector here, the base titanium, who are also coming in with different kinds of support in this particular process. So we've not left anybody behind. But I must say the tourism sector is highly challenged. I think almost all the hotels are closed now here in Diani. So we have left everyone to look at what they can contribute in this particular process, and we are getting contributions of different kinds from the different private sector players.
Actually, what I had in mind when I was referring to the tourist sector was, you see, they have something that very few people have. It's called bed capacity. So if you have a situation where many people fall sick and the health facilities cannot possibly cope with, is it possible for the tourist industry, the hotel specifically at the South Coast, to help with this? This is a sort of assistance I was thinking of.
Oh yes, but I think it's been very clear that if hotels are going to serve as quarantine centers, then people go in and they pay for themselves in those facilities. As we speak, there are around 30 contracts that we are holding in a hotel. So already that has they have provided that facility. So. Yeah, we have around 30 in one of the hotels here that we are holding under quarantine, and they'll be out in the next few days after the test.
Okay.
Is it also possible for the county government, in conjunction with the national government, to prepare and work out package deals with these hotels in the event, just in the unlikely event this happens? Why I'm saying this is because if hotels are functioning at whatever capacity, it means some of their staff will also have an opportunity to continue working. They themselves will be able to continue working. So it won't be a complete shutdown where there's no work and there's nothing absolutely happening. Is it possible?
It's possible for that level of engagement, but I think the situation right now is I see most of them have completely closed because without Europe, without domestic travel from up country, then most of them are not operating now. But it is possible for that kind of engagement.
There's been some concern that has emerged, Governor, that the national government is sort of holding back onto cash that should have been coming to the county governments, and therefore now county governments are finding themselves being unable to address some of the emerging concerns after COVID-19. Is this the case in Kwale?
We have been engaging the national government in for different interventions. Mm-hmm. For example, on the issues of protective equipment and other equipment that we require, and also technical support. We have really been engaging on that. And so far we have received some support, but we need more, and we are continuing to follow up. Like I know the testing equipment. They were sent here yesterday, and we are still looking for more equipment, like the ventilators. We have ordered, but we have also requested more from the national government. They brought us some when we had the patient here. So there are quite a number of areas that we are still following up with them. They have pledged support, so we are following up. Even in the area of food, we have engaged the Ministry of Devolution, and they are also working out something. They will be coming back to us with a concrete response on what they can support. But of course, especially in a situation that we are in now, where we are now under partial lockdown, then we expect that the national government and the county government will be able to work together to channel more support to these hotspots, and we are still pushing for that.
Excellency, what amount of money are you targeting to actually put together in order to solve or to partially help with the situation of COVID in your county, and how much of this amount have you actually realized to date?
We quickly looked around. We need around 450 million to handle the vulnerability and also have other basic things. And currently, as county government, we can raise 200. When we review our budget, we can raise around 200 million. So the other gap is what we have put forward to our partners, and of course, some of it is equipment from national government. So the moment we receive in kind, then we are able to now take down the 450 to a certain figure downwards. So we are able to work around it through partnership.
So currently, what is your deficit?
Our deficit from 450, if we raise 200, then we are talking about 250 million.
Okay.
Yeah.
When I hear you speak, Governor, and when I hear other governors speaking, I'm hearing as if counties have suddenly been rendered like small brothers of the national government. Everything is coming from the national government, and the national government is, of course, taking its time to deliver on its promises. So, like you've just said, you have had discussions with the Ministry of Devolution, had discussions with the Treasury, and all these, you're still waiting for response. Yet, already your county has gone into a partial lockdown. And this COVID-19, if you had 3 or 4 or 5 more cases, you'll not be able to react fast enough as the national government is pussyfooting on decisions.
I think it's not a brotherly, big brother, small brother relationship. I think it's still the functional relationship that we have with the national government. And of course, this pandemic just it baffled everyone in the country. So we cannot say as a county government we can work on our own. Of course, there are those things we can do, and there are those we can't do. We have to seek support from elsewhere. And the reason I'm mentioning national government is because I also know international support comes direct to national government.
Right.
So then we have to put in our case so that we can be part of those who benefit. Remember, we had Jack Ma Foundation contributing quite a lot, and I know there are much more international partners. They do it at the national level. So if we don't engage, if we don't put up our case, how will the international support flow to counties? So I think it's not a brotherly, big brother, small brother, but it is part of what we need to do as a partnership in the two levels of government.
If I may add, Your Excellency, the Kwale government, the government and the county government of Kwale relies very heavily on tourism. If you think of the optics of it, Kwale then, if I'm being prescriptive, and you'll forgive me here, must be seen to vigorously fight the COVID-19, because if we don't, then it appears that we will never be convincing as a site that we're able to deal with these things. What we do with this particular condition is part of the advertising that we give to international visitors that this is a county that takes such diseases seriously.
Yes, definitely. I agree with you. You know, we're a tourism county, having been voted in 6 years running as the best destination in Africa.
Yep.
And COVID-19, therefore, is a big challenge. And that is why we are really concerned. And that is why we want to put everything forward to make sure that we are able to control infection, so that when the situation normalizes, then tourism can be able to be fully advertised with confidence.
Your Excellency Salim Mvurya, Governor of Kwale County, we want to thank you very much for speaking to us this morning.
Thank you very much.
Thank you very
much. And all
much.
the best with all the work that you're doing. Good job that you're doing there.
Thank you very much also for giving me the opportunity to speak to Kenyans on this channel.
Asante sana.